Okay, so from here, we're going to take it over to Lindsay, who is our presenter today. And if you can just kind of take it away for us.
Sure. Okay, wonderful. Thank you, Natalia. I just want to start off by saying thank you to the Canadian Retinoblastoma Society and to Jen for reaching out to me to ask if I was willing to speak a little bit tonight about just our family's experience and my experience as a parent with retinoblastoma. And thank you to Natalia for hosting tonight. And I think I've met all of you in person. Either at last year's symposium in January or we had attended the picnic last June. So I think I've had a chance to kind of chat with all of you before. So thank you, and it's nice to see all of you again. Just want to start off, I've made a few notes. I don't have anything like formal, but I have made an outline of how I want to speak. So hopefully it comes across well and I'm not jumping all over the place. But I'll just start off and say that and kind of go a bit about through our story and where we're at now and just talk about maybe some things that were unique with my daughter's case. So Brian said, I'm not going to use her real name, but I'm going to just call her A. So my daughter was diagnosed in January 2021 at the age of 3.5 years with retinoblastoma, and she was, I believe it was like a grade D tumor, they would consider it, unilateral in her left eye. So I want to talk a little bit about the glow, because I know there's a lot of around the glow and that sort of thing. And I first noticed the glow with Olivia it was just after Halloween in 2020, so around the end of October, early November. And for me, I did not know what the glow was. I had never seen any materials on it before. So I had looked at the glow in her eye for about 2 months, so I think a fairly long time. And I just kept thinking that it was going to go away, and that, I'm not someone who tends to overreact to things, remains pretty calm. And so I just thought, oh, it's nothing, it will go away, not sure. It was also a very busy time for me at work at the time. And so I just kind of brushed it off and thought it would pass. Jump forward 2 months to Christmas, and it was Christmas Eve, and my husband was like, it was and we often noticed it at night times or in the evening, and my husband, when we were reading her a book and we had the lights dim low and it would glow, and we were like, oh, that's weird, but just didn't do anything about it. And fast forward to Christmas Eve 2020, and my husband came home. He had the kids that day, and he said, we got to get something done about her eye, or we got to get that looked at. It was glowing all day today. So no longer glowing in the evenings, but glowing in just regular daylight. And so I said, yeah, we'll deal with that after Christmas. So on it's Boxing Day, not one to Google a lot of things, but I had some time, was laying on the couch, and I Googled, I think I Googled white pupil glowing eye in kids or something like that. And what comes up when you look at that, and a lot of images and pictures of a lot of babies and toddlers with glowing eyes. And I thought, oh my goodness, these are kids just like Olivia, and this is exactly what her eye looks like. And I thought, sorry, Google. And I thought, wow. So this could be very serious. It could be nothing, but considering that her eye looked like a lot of the kids in these pictures, I thought we need to do something about this. So right away, I called and left a message with our local optometrist, and left a message. It was Boxing Day. Obviously, they weren't working, but they were open the next day. They called me right back, got us in the following day for an appointment, looked at it, and said that they were going to refer us to a pediatric ophthalmologist. And so on New Year's Eve of 2020, I get a phone call from the ophthalmologist in London, Ontario, at the hospital there at the IVI Institute, asking that I come in the next business day, which was on the Monday morning. So when the doctor was calling me herself, right away I knew that this could be something. So we went in on that Monday morning, and she did the eye drops and looked at her and told us what she thought, and said she was going to refer us to sick kids to the ophthalmology team, and someone would be in touch. That go down for a COVID test, and within 15 minutes, I had the ophthalmology resident calling us and saying to come to Sick Kids the next morning for a 9 a.m. appointment. So everything happened very quickly, whirlwind, unfortunately, kind of over the holidays. And so in some ways, I'm grateful that we didn't know about this until after Christmas. So, we were able to have a good Christmas. Otherwise, I think it would have been, a little bit more upsetting. But I want to talk, so obviously she was diagnosed in January. And so what happened in her, she was treated. So she did 3 rounds of IAC chemotherapy. So she had that, which is a fairly common treatment now that some of the kids are receiving. So she did 3 cycles of that in January, February, and March. It was, I think this is also fairly common that she had a detached retina. The tumor had grown and detached the retina. So she then in May, once we kind of, had things settled with the IAC treatments, she had surgery for a detached retina. Didn't know a lot about that or what that procedure involved, but the recovery from something like that is, really difficult for a 3-year-old to be laying face down on a, essentially a massage table or something like that for a week. So we did that for the week, and then she had a second surgery for that August to remove the oil that had been placed in her eye, and so she did another week laying down. So we got through those 2 things, and then things were looking pretty good, except that the synthetic oil that was used in her eye to help heal the retina then caused a cataract. So you treat one problem, retinoblastoma caused the detached retina, you try and fix that, it leads to another complication with the cataract. So we kind of left the cataract for a little bit, and it was on the back burner, and we were going to deal with that. By November, she had a reoccurrence, and the tumor was growing again and was no longer calcified or had new spots growing. So in speaking with the team, she was obviously being treated by Dr. Brenda Galley, who I think a lot of you know and have had as your own personal doctors throughout your own journey. She was treated by her, Dr. Ashwin Malapatan, and Dr. Stephanie Kalecki, all at Sick Kids. So we decided we would participate in Dr. Galley's chemoplaque trial that's going on. And I know last year at the symposium, she had talked about that trial and where that was at. So Olivia participated in that for 6 weeks. We did that in December and went over Christmas. She had some complications, I would say, with that, almost dose limiting in terms of, and we were at almost needed to be taken, I think, out of the trial, but she was able to get through those 6 weeks. And those 6 weeks, the tumor was calcified, I would say, again, but I think there was always the risk after that the tumor was going to grow again, or that something was going to happen again. And so talked, and I think it took a lot of coordination among like the ophthalmologist at Sick Kids, and as well as Dr. Peter Curtis at Sunnybrook Hospital in Toronto. And we ended up deciding to do a tumor extraction on the eye. So they actually removed the calcified tumor from her eye in a procedure that I don't think is done very often. But I guess she was an ideal candidate, just, size of tumor, where the location of the tumor was, that sort of thing. So they did do an extraction on her eye as well. At that time, they also repaired the cataract. So that was done in July of 2022. So since then, things, she had some challenges. I think the recovery from that was a couple of months, and it was pretty intense. But once she got through that, she has been doing really well in terms of, there's been no new reoccurrences, and we've now graduated, I would say, last May to she's in the clinic program and is just being seen regularly now through the clinic. And so we just have moved to, we're doing checkups every 6 months. So I think that was a really big milestone to hit, going every 2 weeks, 3 weeks, 4 weeks, 6, 8 weeks, 3 months, to finally getting to that, 6-month milestone. And I was a little stressed about it, but just, because you think about all the what ifs as a parent, and that's a long time in between. Felt like it was a long time in between after going so frequently for checkups, but happy to say that that's where we're at now. So a couple of things I would just want to touch on in terms of what I think made our journey a little bit unique was just when this was all happening. If you think about it, Christmas Eve of 2020, the country went into a lockdown. Everything shut down. And so I would say one of the challenges, everyone, the thing with retinoblastomas is I think everyone has a really unique story, and no two cases I don't think are the same. And there's always, little variances in everyone's case. And in this case, I think what made our story unique was just, and the other parents who are going through this at the same time, is just, getting a cancer diagnosis can be really devastating, but also trying to navigate this through a global pandemic and through lockdowns and all of the things that COVID brought on, and the requirements and the extra precautions that took. Before her very first procedure, we drove 5 hours round trip to Sick Kids for a 30-second COVID test. And so just what all of the COVID procedures put on top of like an already stressful situation and dealing with cancer in a child, we live on a good day 2 hours, on a bad day 3 hours from the hospital. And so those early days of driving and traveling to Sick Kids for COVID testing was a lot. And so we did, I kind of went through at one time and added it up. And I think over that first year and a half where COVID procedures were in place, she had over 25 COVID tests. So you add that to the already, just the treatment she was already receiving for the retinoblastoma. And I think I also counted, and over those first 26 months, she had been under anesthesia close to 30 times. So, 30 procedures for that, and then as well as adding on top of that, all of the COVID testing. And so during COVID, we weren't allowed to do local testing because of the turnaround time, and, we're in a small rural area. So ended up eventually not needing to go to Sick Kids anymore, but we were able to travel to Grand River Hospital in Kitchener, and they have a POGO site. And so she was able to do some of the COVID testing there, which helped a lot, but it was still, the burden of travel on this is a lot. And so it required just, extra days off when you're already planning time off to go to the hospital and miss work, and then adding that on top of it. The other thing with the COVID was just because we were in a lockdown, we were also in a remote learning environment. And so my other daughter, who was 6 at the time, was not attending school. And so that made it challenging too, because trying to navigate taking her to dealing with this new diagnosis, as well as having an older sibling at home that couldn't go to school during the day and was at home. And I was, being an accountant, January is the most busy time of year for me as we're preparing our year end. And so not that there's ever a good time for cancer, but I would say January is the absolute worst month for an accountant to have to go through something like that, just professionally. So we had a lot of things going on. My husband ended up taking a leave of absence from work so he could stay home with my daughter, who was doing the online learning, and just kind of look after some things at home. I continued to work, but I was also the only parent. I did all of Olivia's treatments as well, just how it worked out with scheduling and that. So I did all of the trips to Toronto. So because of only at the time, the hospital was only allowed one parent. And so it wasn't until November, so almost 11 months later, where my husband, Troy, was able to go into the hospital to Kids for the very first time and be there with Olivia during one of her EUAs. And unfortunately, it was the EUA where we were told about her reoccurrence. And so he was in while I was in a hotel room, on Zoom with a meeting with the doctors. So just, I think that was stressful for our family, just trying to, navigate her treatments, as well as just all of the extra procedures, and basically trying to do this treatment alone. I think the other thing that was unique in her case was just that she was diagnosed a little bit later than what I understand most children are, a lot of this is in infants and, you know, not always, but a lot of times my understanding is under the age of 12 months. And so to have a 3.5-year-old was a lot different because I think she knew a lot about what was going on, you know, from day one. We told her, like, she knew she had cancer. She was very strong-willed, being at the hospital and going through some of the treatments, and so it's just different experience. I think having an older child who was very aware of what was happening to her and what was happening around her at the time. And so I think because she was, and I know she may grow out of this, but I would say she does have like a lot of medical trauma because she remembers all of those experiences, and it's just, I think it's just a different experience than having, you know, children at different ages. Like she just remembers this, and anytime I talk about, oh, we're going to go for the kids for a checkup, she says things like, are we going to the second floor? Do we have to ride up the elevator? Because she associates those things with the pre-op room and what kind of bad things happen to her in the pre-op room. Whereas if I say stuff like, no, we just get to stay on the main floor, we're going to the eye clinic, she associates that with that she's going to like have a good visit because she knows nothing bad's going to happen to her. So I think just, you know, having her be a little bit older was just brought on its own challenges as well. I think, and then the other thing I think that was unique in her story was just the whole tumor extraction. You know, I don't like saying that a lot, I guess, to some other RB families sometimes, because that's not always an option for everyone. And you know, I don't know, like, I just don't know how other people feel about that in terms of like, why did you choose that option, or you know, why did she get that and we didn't get that as an option? And you know, but at the time, I think, you know, things change and there's medical advancements, or there's just new things that develop, or new things that are able to be tried. And so in her case, it just, you know, I'm still nervous about it because, you know, I do feel you always run the risk that during that procedure there could have still been an active cell in there, that in the fluid that was you know, could have escaped during that procedure into other parts. But I also feel like you know, we did testing and that sort of thing, and things looked good at the time, and things still continue to look good in terms of the pathology on that. But you know, that was just something I think that was really unique too. When I first talked to Jen at the picnic, I think, and I told her and her mom about that she had her tumor removed. I remember her mom, you know, couldn't believe it because she had never heard of that before, and just didn't know that wasn't even an option, or that they were doing things like that. So it happened for Olivia, and just something that I don't think has happened very often. I asked the doctors at the time, well, how many of these have you done? And I think they were counting on one hand the number of times that they had done a tumor extraction at sick kids. So, you know, pros and cons to that too, in terms of your level of comfort with that. A little bit, something else I wanted to just touch on in our RB journey was just the overwhelming sense of community support that we received, and how that helped support our family. We live in a small town that at one time was about 5,000. I think it's now more like 15. But both my husband and I were born and raised here, as well as our parents and our grandparents and other generations. So we have a large network of family and friends, and so I think what got us through a lot of that really trying time over those really, really hectic first 12 months was just the support that we received from our community, from my coworkers, from friends, families, complete strangers. We didn't, you know, I did a Facebook post for my family and friends to see what was going on, but you know, immediately in today's day, people are like, can we do a GoFundMe for you? Can we put something out there? We want to support you. And I said, no, absolutely not. We're going to continue to work. And we don't necessarily need the financial support, and just didn't want that as an option for us. But, you know, people find other ways to help support you. So although we said no to a GoFundMe, you know, the amount of support and cards and gifts and care packages for Olivia that ended up on her doorstep was just overwhelming. And if there's anything that makes me emotional about this journey we went through, it was just how much support we received from our community. And I think, you know, financially, you know, I think we have our travel covered probably until she's a young adult in terms of anything we need in going to Toronto. You know, she needs new glasses in the future, anything like that. Like, I just think, you know, I cannot believe how well we were supported. And so, you know, there's pros and cons sometimes, I think, to coming from a small town where sometimes a lot of people know a lot about your business that you may not like, but in other cases, when times are tough, I think that having just a small network around you that can explode into something else was really great. So, you know, I think the community support was pretty amazing. And then I think I just wanted to touch on what we've done with that in terms of being able to give back. I've spoke at a few different things and tried to help out with, you know, bring awareness where I can. And our family's done a few fundraisers now that we're in a position, I think, to do so, and kind of coming out the other side of this where we're not in active treatment, you know, thinking about ways that we can give back. So we've hosted 2 fundraisers since we live in a rural area, and my family really enjoys riding ATVs. We've been able to host a fundraiser for where we did like a ride, and we had, you know, about 100 different people on ATVs show up, and we did a trail ride. And through that, our first year, we were able to raise around, I think it was 32,000, and then the second year we scaled back a bit just because we didn't do a few large auctions and some stuff, but we still raised about $10,000. So we've been able to turn that around and donate that money to sick kids, to the ophthalmology department, so that we wanted to give back to not just cancer patients, but just any patients that were seeking treatment for various eye issues at the ophthalmology department, as well as we made a donation to Dr. Galley's Retinoblastoma Research Fund at Christmas time for about $10,000. And so just trying to give back where we can, because again, like, you know, the community around us has been pretty amazing in terms of, we said we want to do a fundraiser in September in support of like Childhood Cancer Awareness Month, and that's what kind of happened and came out of it. So just a few things I wanted to touch on and share with us. And so, as I said, where we're at now, I think we're in a really good place. We were just to sick kids at the end of January for a checkup, and everything looked good. So we're gonna go back there probably in the end of July, early August, but she's doing really well. She is a grade 1 student, so the same age as Taleem's son, so she's doing really well, but she's really aware of what happened to her, and then sometimes I think she's a little uncomfortable. You know, maybe we're too honest with her at times in terms of what she was going through, and so you know, she does get, I think, embarrassed easily just when people. She doesn't like to be centered out, and not centered out for her cancer, but just like more like special recognition. You know, we tried to do something at school too in September for Childhood Cancer Awareness Month, and we did a thing on the kids' announcements, and so, you know, and it was great. But now all the kids at school, she's in school, 700 kids, and the kids at school, I said one day about, oh, my daughter Olivia, and they're like, oh, we know her from the announcements, and then so kids, like, you know, nothing's been negative in terms of it, but she doesn't like the spotlight, let's just say that. But I think she's doing well, and you know, has really, we say, come out of her shell out of all of this, and is thriving. And I did see a question. So yeah, she does have unilateral. You know, we did the testing and everything come back as unilateral, and so that's what it is. Yeah, and non-hereditary, obviously. So yeah, but yeah, I think that's all I had prepared to say, but happy to take any questions if anyone has any questions about anything I've said or Journey.
I have a question.
Mm-hmm.
So Logan my son was also unilateral, non-hereditary. At the time of his diagnosis, he was like at the end of stage 1, but he was also like a grade D. It was like a grade D tumor. So he was almost to stage 2, based on the staging criteria.
Yep.
And they had said to us that he was too young to have IAC.
Mm-hmm.
Just because of like the damage that it could do to him at because he was only 6 months old.
Yeah.
But they said that they would, the 2 options were enucleation or systemic chemo. But they also mentioned that after enucleation, if that is what the route that we were going to go with, there would have been, I believe they said 30% or chance of systemic chemo based on the pathology results.
Mm-hmm.
So the day of the EUA, they came out and said the best course of action would be to remove it. And I believe prior to that too, we didn't have any information yet for genetic testing, but I remember Dr. Gowley was saying if it's unilateral, then it's the likeliness of it being hereditary is very slim.
Yeah.
So they said that they didn't see anything in the other eye, and they said that that would be the best choice just because it would avoid any kind of, but then there is that, that big question mark of like, what if the pathology results came back and it was, there were some cells that had escaped, then we would have had to face chemo anyway. We did get very lucky. His pathology results came back with clear margins. So he didn't require any chemo, but like, sometimes I would go back to that and think like, what if he was older? What would we have done? Did that ever cross your mind to like, given the stats, our anxiety being parents is so high, health anxiety. And I know what you're saying, when you're saying, oh, you don't know, like during the extraction, what if what if a cell had leaked or, do you sometimes think about nucleation as the first option
as the first
opposed
option?
to what you had decided? Like, was there a choice or like, was that?
I think that there's always a choice for sure. And they laid out that, when I look back on that day, like I felt like I was like making a choice almost like there on the spot or like within a 12-hour period. Like there wasn't a lot of time to think about it. I remember, I think I was there for 9 o'clock. By 10 o'clock, we had done the imaging, and by 10 o'clock, Dr. Ashwin and Dr. Clucky were in the room and kind of confirming what it was. And by 5 o'clock, we were having a meeting with Dr. Sheikh and the oncologist team, and 6 o'clock she was having an MRI, and so everything happened very quickly in that day. And of course, I think enucleation was definitely an option on the table. That was always an option, and I don't think they were pushing. I don't think they were pushing IAC, but I also felt like they really felt strongly that could be a viable option for her as the first option to try. They had just said that they had good results, I think, with some cases maybe, or like good success. And, I didn't read a lot about it. I have read a lot, and I've read a lot of medical articles. And in that first week before she had the first IAC, I certainly read a lot more about it and came prepared to ask some more questions. But, I think I talked to my husband because pretty much we had to make this decision on the phone that day. But I think I wanted to try it as an option first, but that was certainly, we did that. And basically what I said to him, because I think they thought that because of she was unilateral, and where the location of the tumor was, it was very in one nasal area. So I think the big thing was their I don't want to say like selling feature, but was that the tumor was not blocking vision. So at the time she still had full vision. And I guess as much as I was concerned about cancer, I was also concerned about like her impact on vision. And so they thought, here's an option to try. Her tumor currently, I think if there was a problem with vision right off the bat, like I don't think there was any sense of going through with the IAC, right? Because I don't think it wasn't going to make the vision come back, I don't believe. So I felt like, let's try this, right? Like she still has full vision for right now. So let's try this, see if this can work. And so I didn't give it a lot of thought because I really felt like we could try the IAC route. We did, but when I would say where I thought more about enucleation is when it came back the second time, and in the reoccurrence. We did the chemoplaque trial. Some of the things were like, oh, I think it's, obviously it's a trial. So there was a really big part of me. I didn't obviously want to risk her life, but I also felt really strongly about being part of something that could lead to, future research in order to help pave the way for other kids who are going to come after her. And if we could do something that wasn't, going to put things at jeopardy, could we try this as an option too? So we did the 6 weeks, but it did not go the way I expected. And it was extremely difficult on her, and it was very hard. And that was not what I think prior patients had experienced. So after the 6 weeks, my husband and I said, we will not do any more. We have tried those 2 options. Like obviously the IAC didn't necessarily work when it come back again, but I was not going to try IAC again. We had done the chemoplaque trial, and I said we were not going to do systemic chemo. At that point, we would enucleate. Like if it came back again, I think that was it. I didn't want to put her through anymore. I think we had tried some options, but I wasn't willing to go there with the systemic chemo. I just think she had enough. If that was, I guess, the first option that was presented, maybe I would have been willing to try the systemic chemo first, and that would have been our option. I think I was always willing, if there was an option there, to try one thing or 2 things, but I wasn't going to go through the whole gamut of all of the options before enucleation. I just felt like if we can't get this after 2 times, I don't think we're going to get it. So, but the thing is, she has kept her eye, and they extracted that tumor, and, her vision is very good. I would say it's like 40-20 or 30-20. It seems to kind of fluctuate. Where the vision has been most impacted now was because of the cataract. After the cataract, I think she's like 400 or 600 or something, like over 20. Like she really had no vision after the cataract, but it did take time, and it did start to come back. And I'd say she's lost her distance from afar. So, which is what happens when you have a cataract. You can get, I think they put on an artificial lens, so you only get distance up close or far, and they choose which one you're going to go with. So, so she wears it she has the far distance. It's the up close that's really blurry for her. But so she does have some vision impairment through the cataract, but I think, it's such a hard choice. It's such a hard decision to make, and certainly it still weighs on me. Like, did we do the extraction, which I think was risky, right? But I don't know. It's hard to. I don't want to second guess myself too much on it, and try and feel confident in what we did. But I think the other thing my husband and I talked about was we wanted, and this is not to I think every parent tries, and you make the decision that is best for your child, and that is the right decision for you. For me, I just wanted to tell her we tried, so that when she gets older, I just wanted to tell her we tried some options, and this is what was available to you at the time, and based on your case, and the situation and the scenario. So I just wanted to be able to tell her that we tried what we could do, you know. So I don't know that if that helps or answers, but it's just it's so hard. It's hard to make the right what is the right decision, and I don't know.
Everyone has their own
criteria,
path.
right?
Yeah. I have another question. Like, this is more for like all the unilateral survivors that are in this call too. Isn't it odd that it's the left eye? Like my son's is the left eye too. And I believe, Lindsay, you said your daughter is her left, was her left eye.
Yes,
David's left eye. Like
I'm right eye.
is it your left eye too?
My right eye.
Oh, okay. So we've got like 1% of someone, 10%. But I just feel like a lot of people that I've spoken to who've had unilateral, it's always been like most of them have been the left eye. And I wonder, and even with Lindsay, like you were saying about your daughter, she was 3 years old. So I wonder if this is something they're born with, and then it like there's slow progression or faster progression for certain people. But
yeah,
I was looking at the birth records the other day because I was trying to look for a prescription. Sometimes I have copies of prescriptions for like something like a UTI for my daughter, just in case. And I looked at my son's file just because I was, just looking at a few things. The day of his, the day he was born, you know how they do all the different, the APGAR test, etc. I looked at his eye exam that they did there, the red eye reflex. It said deferred. It said red eye reflex deferred, and then there was a comma within normal range. And I said to myself, oh my gosh, I didn't even pay attention to this then. I didn't know. I just thought, oh, okay, whatever. It was late, but then within normal range. So I feel like there are certain things that happened that I didn't know about, just because of like not being educated about retinoblastoma and not knowing about it. Obviously it's not like we're doctors or anything, but even like after, like when just right before he was diagnosed, like I kind of felt like our stories were so similar. Like when you were saying you noticed it for a while, and sometimes you'd bring it up, sometimes you would think about it. That was the same thing with me. And then I felt like after I brought it up again for maybe like the 10th time with my husband, he finally kind of validated. Like I was looking for validation almost. Like he was like, you know what? Let's you've seen it often enough that I have also noticed it. Let's bring this up with the pediatrician. I'm like, why did I need to wait for that? Why didn't I just do, like, it's like I was scared. Like I think it was fear. And you said like something that really triggered, like that really made me think about that. You had said, maybe this is just something that will pass, like I just thought like it was just something that we saw. This is exactly how I felt. I remember in the elevator, literally about to go for his 4-month wellness check for his vaccinations. And I'm seeing some weird lighting in the elevator happening, shining on his left eye specifically. I even mentioned it to my mom, and I'm about to go into the doctor. She says to me, why don't you mention it to the doctor? And I'm like, you know what? No, Serge isn't here with me right now. It's nothing, it's but I felt like it was something. And it's like something that just like, it's like a mixture of fear, the unknown, and like, I don't know, like, is he going blind? What is this? Like just that uncertainty, but then us waiting for someone to say, okay, let me take your hand and go with you to the doctor and let's figure this all out. I felt like it was just so similar, like the mom situation in this.
I think for me, I know some friends or people, and they're very extreme one way in terms of like every little thing they're like running to the ER department, and I was always like so annoyed, but I'm like, oh my God, just like let it be, or it'll work itself out. And so I just didn't want to be like that mom that was taking my kid to the hospital. And I also felt like because it was COVID at that time, I was really like, I don't need to go there for this. Like, I don't want to like hold up other people. And there was so many procedures, even trying to get a doctor's appointment. And I really didn't think it was for the extreme. So I was like, nope, there's other people that need to go see the doctor more than us. I'm not gonna like tie up the system with this, right? And I think too, you know, looking, yeah, I just didn't want to be that annoying mom. And honestly, my doctor sometimes, like, I'd say, play some stuff off. So I honestly think, had I taken her, I don't know that the doctor would have been concerned, and I don't know that she would have like referred us on, or I think it would have taken like months before we would have got a referral. So, you know, in some ways, like, I beat myself up about, could I have went sooner? Could I have went in November? But I think, you know, I got to think, well, if I would have went in November, we probably would have got passed off, or we would have got put on the referral pile, and we would have been 2 or 3 months, because that's what I've heard with some other, when they try and get referred to someone else, like, it can take that long if the doctor doesn't think it's like an emergency. So I you know, in some ways I beat myself up, but I also think, you know, it might not have happened any faster if I would have taken the family doctor route.
That's really, that gives me some perspective too, because like I'm always beating myself up about it too. And then I know for sure that if I did take him on my own, it's exactly what you just said. It would have been brushed off, and God knows what would have happened. Maybe this would have been more delayed. Maybe we would have been looking at chemotherapy. We could have been looking at a longer road. So I really think that everything happens for a reason. And I do want to say that I think you made the absolute right decision for your child, for your family, for that situation there. I think you're doing an awesome job being an advocate for your daughter. And I think you're an awesome mom. And I just want to say that I think this is such a great, I'm getting emotional thinking about, like, this is so important to have this community, because I really think we need each other. It's really difficult sometimes to think about everything that they're going to go through, just even emotional support. I'm experiencing it a little bit now. I held back because I wanted to hear what your story was, and I wanted to see what you would all have to say about this. But I'm getting some phone calls every week from school because he fell. Oh, Logan slipped in the bathroom. Oh, Logan, bumped into the wall. Why am I getting a phone call about this? I'm at work, or, I'm like, my heart is beating so fast. I see the school, ringing on my phone, and I'm thinking, what is this? Is this an emergency about his eye? Somebody threw an eraser at him. I got a phone call. So, and then when I asked,
you are not alone on that.
It's extreme.
My coworkers laugh at me because every day, once a week at least, and there have been times where I'm getting called multiple times a week, the same thing, and I'm like, walk out my office like, oh, the school called again, and I will get called at least once a week. And unfortunately, my office is about 30 seconds from the school. So my kids know that too, that I'm really close and can be there to quick pick them up. But I have experienced that as well, where I am getting phone calls every week. And I don't know if with her, because they kind of know a bit about her history, they're like extra precautious. So it's like, oh, she fell, she bumped her head. Like, they immediately call me, because I think too, like, they just know and don't want to do anything that could have been, like, oh, would this have affected something? So
that's exactly it too here, but it's like a blanket statement though, like, oh, cancer. So immediately they think, oh, chemotherapy, oh, they're frail, oh, they're fragile. So when I asked, is everything okay? Is his eye okay? Like, is his other eye okay? Is like his live eye, like his living eye? And they're like, yeah, no problem. He's okay. He fell on his knee. We gave him some ice. I'm like, okay, thank you for letting me know. But, we just want to let you know because, for his appointments. So that you keep a record. I'm like, what do you mean his appointments? And I became a bit of a mama bear there. And I said, I advocated for him. And I said, you know what? My son can see better than you and me. He is totally fine. He sees, he goes to sick kids once a year. He has a prosthetic eye that gets tended to every 4 to 6 months. He's totally fine. I said, and that was my way of just saying, you do not need to call me like for every small little thing, because that is, my PTSD is being triggered. Like I'm, it's very, it's so it's hurtful. It's a little bit like, and my husband's like, don't worry, don't look at it like that. Like, think of it like, oh, the school's calling again. I wonder what happened now. Did he like trip over like a rock or something and like bumped his elbow? Like, he's just trying to like kind of like give me some comical relief about it. But I'm more like, upset about it than he is. I just don't know how to
I honestly, I almost answer the phone laughing now when the school calls me, because I'm like, hello, what is it?
Yeah.
Because like the phone calls are, yeah. And it's not just for for A, it's also for my other daughter too. And I probably get more phone calls for her, and she did not have cancer. So I think it's just, it is what it is. But
I get those phone calls almost every day too. My kid's always falling, hitting her head. But I asked them not to call me. I said, I know you have to tell me legally or whatever. Just shoot me an email. Just so you've told me. Because the same thing, I'd be in meetings and my phone would be ringing, and I know it's something just stupid that they don't need to be calling about. But so I mean, you might try that, and then at least you won't be getting the phone calls, and you can just like, okay, great.
There is that, I think with anything, I think there's always that level of like PTSD or anxiety that going through something like this journey, very traumatic, that then you see the phone ring and you always sometimes think the worst too, like what did, is it going to be a bad phone call too, right? So,
and it's like your other children too, because you have other children. I've got 2 other kids, and for me it's like, do I ever get like a rest, like a break from the phone calls? Like it's constant, and it's always about like something silly. So then the time that I am gonna get that phone call, it's kind of like going to be like the boy who cried wolf. Like, am I gonna, and what am I going to believe? Like, I kind of feel like there's a little bit of special treatment happening in a negative kind of way in this case. I don't want that for him too. I don't want him to feel like the special case. I want him to feel like he's like any other kid, and I think that's the problem. So I think as he grows older, he'll learn how to advocate for himself.
Yeah.
He's so young still, he's only in grade 1. But it's just a matter of kind of growing into that scenario. And I think it's like a big thing for us too as parents, like we're going to grow into that with them. I think it's harder on the parents too to accept certain things, because we don't want that for them. We want them to feel like their sibling, like their sibling who's okay, and I mean, not that they're not, but it's just it doesn't feel good getting
I know, and I think that for my daughter, I think like, she's been through something, and I want her to use this as a positive experience, and for the survivors that are on the call here, and you can maybe relate, like she says, like all of you have had something really bad, like not, I won't call it bad, but it was an experience, right? And I just want her to turn that around and do something good with that down the road, like be an advocate or raise awareness or do or just be her. But that's her own. That's just been her own journey, and we all have our own journey, whether it's cancer or not, right? And I think that I just want her to do something great with whatever it is that whatever happens and she chooses to do. And we did have a very scary experience last March break where all of this was almost for nothing. I would say we had they were away and had some fireworks for a birthday celebration, and a firework went off, and although they were a distance away, when a firework is shooting out, it can be very dangerous. And she actually had a firework hit her. Thank God she had her glasses on, but it hit her on her left eye, just below her cheek here, and burnt her face, and knocked her over. Like she fell over and her glasses broke. But I think you go through this whole journey, and sometimes you let your guard down on certain things, and I think you really have to like, you don't want to, like we talked about the things that happen at school, and like you want to be like, let them do and not overreact, and then let our guard down, and then like we almost ended up losing her eye or having a very bad experience over something completely unrelated to this, but was just a fluke accident. And I think that really reminded me, we gotta like be careful with what we're doing here. So
I still remember, like, I'll be 40 in May, and I still remember growing up that like I always had really thick glasses and got made fun of a lot. But so when I was old enough to make a decision with my parents, like old enough to make the decision according to my parents, I guess, I looked at the contacts, and it was just, I mean, but they had said, like, my doctor was like, I'm not going to tell you what to do, like, it's your decision, but just keep in mind, you only have one good eye. Your glasses are going to help to some extent, not 100% obviously, but going to protect that one good eye. And I mean, 20 years ago, it ended up with the level of astigmatism that I had. I saw way worse with contacts than I did with glasses. And so it didn't really help the situation. But I mean, I was to the extent of like, I was going to get contacts and then just wear plastic glasses just because I was so sick of being made fun of with the thickness of glasses. So I'm curious, those of you that have kids, younger than myself, have you guys dealt with bullying and being, your kids being made fun of, or is it something that obviously I assume you probably tell like the teachers and stuff, but is it something that other kids and stuff is it public knowledge, I guess, is my curiosity, because as I get older, I have debated who to tell what to and who I can trust is what it comes down to it.
I think for my daughter, Olivia, she's very aware. I think where we've had the trouble with, I would say, not necessarily bullying, but just being like made to feel different, was she's supposed to be patching her eye, or patching her good eye to strengthen the eye with that had the cataract in it. And just because of our schedule and our routine, she was wearing the eye patch to school. And we did really well with that last year. And so she was wearing it for 3 hours in the morning, and her class was very accepting. I don't think anyone batted an eye at the fact that she had a colorful unicorn eye patch on her eye. But then this year, there was some older kids that pointed that out to her, and not in a mean way, but they're like, "What's that on your eye?" Or what? Just because they weren't used to seeing something like that. I don't think it was meant to be mean, but it immediately made her feel different. And so she has, since that day, she will not wear it again. We have to do it at home. She just said it's embarrassing, is what she says to me, that it's embarrassing and that she looks different. And then there have been times, because of her glasses, like with the bifocal lens, it does. So I know what you mean, like her glasses aren't thicker, but the bifocal makes sometimes her eye look bigger on that eye. And so she has made a few comments about her eye looking funny or different or like larger just because of what the lens is doing. But so far it's been okay. I think there's she's young enough at this point that it's not too bad. I think where I worry about it is in later years, as they get to be that 13, 14-year-old kids, where kids can just get a lot meaner, I think, and then they just and she's just going to be more aware of her appearance, I think, and she makes comments. She'll make comments like, I think she's going to be hard on herself, but I think that's also her personality. So I don't know about the rest, or how. Sorry, Natalia.
Yeah, I was gonna say the 13, 14 age for sure is that time where everyone becomes a little bit more aware of themselves and of each other. And just for any typical kid of that age, appearance and, identity is just such a thing. This might not be the answer for everybody, but I was experiencing some bullying when I was in grade, I don't remember now, 5 or something like that. And I don't know whose idea it was, but what we had is we had the CNIB come to my school and we did a presentation on eyes. And then there was like different eyes that they could kind of like, there were models. And so they could identify like, what's the retina, what's the pupil, what's the iris, all these things. And then we also had like, okay, we did some games where everyone was blindfolded, and then we would squeeze toothpaste on one hand and like, I don't know, glue on the other, and you had to use your other senses to figure out what it was. So they did this whole presentation focused on my experience of having low vision and my whole class was part of it, and they made it fun and they made it educational. And then at the very end, there was like an open question and answer period for me. And so then my classmates could ask me. I remember this one kid asked me, when you sleep, does your fake eye stay open? And I was like, what? Like, what kind of question is that? But it's one of those things that he was probably thinking about that forever. And this is finally his opportunity to ask these questions with an open floor and not in like a weird, on the schoolyard and me getting really upset and offended and like,
Very
just
curious
not
that
wanting to
he
talk about it.
probably felt it was a safe place to ask you that.
100%, right? And so then after that day, I had no issues ever again, because for me, what I learned is education is power. So people get uncomfortable and awkward and poke fun when they don't really understand. And then once everyone understood, like, what happened to Natalia? What can she see? What can she not see? I asked her all the questions I was curious about. Cool, now she's just another grade 5 kid. I don't really care. Let's go play soccer. So I found that really brought down that weirdness between myself and other kids. And a lot, probably for you, Lindsay, for your kiddo, she's probably going to go to high school with everyone that's in her school because of it's a small town. So if that whole thing happens in elementary school, then it'll just bleed into high school and everyone's going to be like, oh yeah, that's just that girl. I know exactly what's going on for her. She's just, another grade 9 student. It's no big deal. So that was what really helped me.
I think
and
that's awesome though that
I have no idea how it actually happened. I should probably ask my parents,
I was
but
gonna say, were your parents obviously
I'm
maybe
pretty sure
behind
they
some
were
of that?
involved in it
Yeah.
in some way. Yeah. But for me, education is power. And now I know that, like, if people have questions or if I can see that people are hesitating to ask me questions, I just kind of put it out there. When I had job interviews, I would just put it out there and just be like, this is what you're probably seeing. This is what it is. This is how I mitigate these challenges and these limitations I have. It's a non-issue. Let's move on. And then people are just like, cool, no problem. So
you're a lot more confident than me, Natalia. I think I'm probably more like Olivia, where I'm like, I don't know if it's I don't want to say Olivia's not confident, but like,
no,
I don't want to be the center of the attention. And I remember like in preschool, kindergarten, getting called 4 eyes and things like that. And but I still remember, and I don't know, it was elementary school, and I'm from the United States, so I don't know how much you guys know. I'm thinking like grade 1 is like 6-year-olds.
Yeah.
When you say, okay, so is that the first year of like traditional school in Canada? Okay.
Well, JKFK, so they start in grade age 3, 4.
Okay, so it'd be similar to like our first grade then.
Yes.
I'm thinking, but anyway, so yeah, it'd be probably 2nd, 3rd, 4th grade, a little older than that, like 8, 9, 10. And I don't remember the whole detail of it, but I remember the teacher had all of the kids cover up one eye because I'm blind in one eye. And I know she had the best intentions and she was trying to educate, but it just put me on the spot. And I remember it now, almost 30 years later, just hating it. But I don't mind the questions. If somebody legit comes up to me and they're just curious and they're not like, hey, 4 eyes, why do you have glasses? But it's like, hey, why is like legit, they're curious. Like I had radiation, so like my eyes are a lot deeper. I don't know if you guys can tell from Zoom, but like, I have a skinnier face, and so it's more like you can definitely notice it, not because of the cancer, but because of the radiation. But so somebody asked me about that, I'm happy to share, like that's easy. But I still remember though, one of the teacher was talking and the kids, and the teacher said something about, do you want to share what it's like to see out of one eye? And I turned around and I looked at her and I go, well, what's it like to see out of 2 eyes? And she just looked at me and she's just like, oh,
I love that.
I was like, I'm like, I've been blind basically in one eye my whole life. So I had to share that one, but then I also wanted to ask Lindsay that was talking. So I'm curious, because when you were talking about, and maybe it's just because it was so many years ago, and like you said, every situation is different. Maybe mine was more severe. I don't remember what my mom said. I actually sent her a text. I said, Mom, do you remember what level of cancer mine was? Because she remembers all those details. I was 5 weeks when I was diagnosed and then relapsed at 15 months. So I remember all of the EUAs, like following up years later, years later, but I don't remember treatment. But you were talking about them being able to fix a detached retina. And see, that was the whole thing, is my retina specialist so I saw the same guy from infancy until he died a few years ago, and now his son took over his practice. So now I see his son. But that's what they had always said, is they said, well, you have a detached retina, so there's nothing we can do. Like, and I have a cataract in that eye, but they're like, it's not even worth putting you under anesthesia to fix the cataract, because it's not going to fix your vision because you have a detached retina.
Right.
But you're saying they were able to fix that for your daughter.
They did. Yes, they did. They did.
So now you've got me intrigued, because
Yeah.
when I was, when I was younger, like I've found one other person, because I went to the International RB conference in Washington, D.C. What was that?
2 years
5,
ago,
6 years ago or whatever.
17, I think it was.
Yeah. And so since then I've met quite a few people, Facebook there, whatever. I've met one person that was older than me that is still alive, that survived retinoblastoma. I mean, he's completely blind, and I don't know if he's 65, 70. But most people are either, people like you guys that have kids, or people younger than me that have survived it. But yeah, I'm intrigued on that, because, when I went through it, that was their first option, is they were like, well, I had bilateral, so they still would have had to do radiation and stuff, but they still wanted to take the worse eye out.
Yeah.
And we had another gal that we had met. She's 6 weeks older than me. Both of us had bilateral. Neither one of us had any hereditary cancer of any kind on anything that we know of. But yeah, we both had bilateral, which is weird. Not related, never met, lived a mile away from each other. Both had bilateral retinoblastoma. She's 6 weeks older than me. But anyway, so they took out what they thought was her worst eye, and it ended up being that they ended up taking out the better eye that they should have, just in the end of everything, that they should have waited. And so anyway, my dad was basically like, no, you're not taking my daughter's eye. Like, I want that to be her decision. When she gets older, if she wants to take it out, that's fine. But I don't want her to have to go through prosthetic and cleaning and all of that. Like, no, you're not taking it. And that was a huge risk. This is 40 years ago almost. But that's been my thing, is like, because anytime I've talked to my doctor about it, they've always said, well, because it doesn't hurt to just sit here and talk to you, but it's very tender if it gets bumped or anything. And my doctor's like, well, you either deal with the pain or you take it out. That's pretty much your option. And now at this point, it's like, basically my doctor said it's pretty much dying. So I don't know, it might be too late now, but that's been my dream because they said if they took it out and put a prosthetic in, basically there'd be no chance of ever doing anything to, restore vision or do a whole eye transplant or anything like that. Like, being able to like do maybe not a whole eye, but like a retina transplant, or I don't know. I'm not a doctor. I don't know the science technology, but that was my reason personally to keep my eye. Was my dream is sometime in my life is to be able to answer that question of what is it like to see out of two eyes. So anyway,
yeah, and when in terms of the detached retina, like that, it was detached, I believe, from day one, but the cancer was the bigger concern, and obviously the cancer is what caused the retina detachment. And
right.
So they said, well, let's tackle the cancer first, and let's get that under control, so to speak, and then we'll deal with the detached retina. And yeah, it was like really, like I said, it was January to May, and in May she did the surgery, and it seemed like a normal, and like I know several adults who have had just like not related to cancer, but just for whatever reason have had a detached retina, and someone I know had the surgery, probably an adult, like a 65-year-old adult, like a month before she had hers. So like I do think detached retinas can be common for different reasons. I've asked the doctor, like, when else would this happen? And well, for various reasons. It can, I think, happen on its own. You could, as a result of an accident or blunt force or something like that.
Yeah, I've heard that because of injury.
There was a child who had also had the retina reattachment the same day as Olivia when we were doing the follow-up the next day at the clinic with the doctor. And I don't know, like his just detached on his own, like it wasn't related to cancer or anything. So there are other cases where you can have it, but I also think that it, in some situations, like there's certainly a surgery to repair that.
Yeah, and I know I have a lot of scar tissue, so that might be part of the issue too.
But I also
but-
don't know, like you said, I'm not a doctor either, but like you said, 40 years ago, and I like things have really things have changed, and I think there's been a lot of advancements, and maybe that wasn't an option 40 years
Yeah,
ago,
it just
right?
surprised me
And
though, because,
yeah,
sorry, go ahead.
no, I just gonna say like that maybe wasn't an option at the time, which is now an option now for patients. And I look at that with like even the IAC. I don't believe Sick Kids was doing IAC. You know, Olivia's born in 2017. That did not have. I don't think they started doing that until like, I don't know, 2018 maybe or something. So I think even in her like short lifetime at that time, like 3 years prior, that was not even an option for treatment. So I think
Right.
treatments have, like, things change and evolve. Sometimes it takes a long time, but sometimes new options come at play. I look at that with the chemoplaque trial, and you know, that wasn't an option, and now it is being an option for a lot of patients. And like you said, like maybe there will be a time where there are future procedures that can happen that haven't even been developed yet. And so that's where, you know, the
Yeah, I mean, it's
medical
definitely
science, like
a
things can change, right?
conversation
And yeah.
that I'll have with my doctor, because like I said, I saw the same doctor, from the same retina specialist from the time basically I was diagnosed, you know, at infancy until, I don't know if he died maybe 10 years ago. It was before COVID, but I don't remember exactly how many years ago. And like I said, it's his son now. And so it just intrigues me that it's never even been an option. He's just always said, well, your retina is detached, so there's nothing for us to do with your cataract because it's not going to fix your vision. But it just surprised me, because in all the people that I've talked to, you are the first one that I've talked to that I've heard has said that they were able to reattach the retina.
Yes.
But when the retina was detached, when your daughter had the cataract, was she able to see out of her eye though? Like
She was, but the detached retina, yeah, the cataract didn't develop till after. It was like cause and effect. Like the tumor caused the detached retina, and then the detached retina caused the cataract. And it
right,
was
which is how I was explained to it from my eye.
And it was we had to put a silicone oil in to hold the retina down. My whole medical on this is like they had to put that oil in to hold the retina down so that it could stay stable. But you can't leave that oil in for too long, because the longer you left the oil in, the more likelihood that oil could cause or create a cataract or something like that. And so we took it out as soon as they started noticing that like a cataract was forming. But there's like that small balance of like you do one thing to fix one thing, and like the risk is like it can trigger something else, right? And I knew that going into the retina detachment, like that was explained to me at the very beginning, that we're going to do this, but one of the risk factors is that she could get a cataract as a result of what we're going to do here today. And then if that happens, then we're going to do another surgery to fix that. So one thing,
the cataract surgery is fairly minor most of the time. It's still a surgery, because that's what I was surprised that
it's still a surgery.
They didn't want to do
I think when she did it with the tumor extraction together is what I think created a lot of like recovery for her eye. We were doing eye drops, 16 eye drops a day. And at one point we were doing the one eye drop every hour, so for 12 hours a day. And that was, was challenging to administer. We got to a really good point where she almost could have done it herself. And we got to a point where she was doing the eye drops at school, and the vice principal was giving them to her, and she'd just go down to the office. And like we got really good at it, but it took some time. But but there was a lot of inflammation or something. It did not go well to recover as well as what it was expected, but we did get there. It just took some time.
Well, maybe that's an advantage of not, something that not very many advantages come out of is being able to put eye drops in, because like I have allergies, and so I have eye drops that I use occasionally, and I just do it. Like it's not a big deal to me. And my friends are like, how do you do that? Doesn't it hurt? How do you keep your eye open? I was like, I don't know, I just do it. but I never really thought about it until I hear you talk. And I'm like, well, I do have to, I had eye drops way more often when I was younger, but, I still go in. I mean, at this point I go like every other year, just because the likelihood of it'd be more other issues going on than like having retinoblastoma at 40 years old, having a relapse. But I still get, like getting your eyes dilated. I've had my eyes dilated way more often than most people, especially as a kid, but even at my age. So, maybe it's an advantage in that respect. But yeah, it's just interesting. And I'm, like I said, my eye, they said basically is more or less dying at this point. So, because it's shrinking so much. So it's probably nothing they could do this many years later. But that was my thing, is like, if it wasn't an option in 1984 when I was born, if it was an option in 1990, why didn't they give it to me? Why didn't they present that as the option then? So when I had been seeing the same doctor ongoing, but it probably just wasn't an option for my case specifically for whatever reason. But still intriguing. I'm happy to hear that there has been advances in doing that going forward.
I think too, maybe, I don't know, speaking here, but I think one of the advantages in Canada is that I think we have, I feel like, such very few doctors who deal with retinoblastoma. And one of the advantages of that is, I think, like with Dr. Galley and her team, like you get highly specialized, really focused on that. And so my understanding is, like in the US, and just following some stuff, like there's like doctors in every state that treat that. But I think the one thing is, like here, like, I don't know, like I feel like there's only a few centers that you could go to have treatment for this. So when you are being treated, I almost feel like you're getting the best of the best in terms of, and you don't get as much maybe variance in terms of, like, obviously treatment for your child and what's maybe best in this scenario. But like, some doctors in the US, I think, will do one thing where another doctor would never do that. So there's a much wider range of things that go on, I think.
I just wanted to mention as well, the other Lindsay, that technology wasn't around. I'm older than you, and technology wasn't around, and they didn't have access to information like they do now, right? They do a research project, they can send that out to everyone who studies RB. And that just wasn't available back then. So I think that has a lot to do with it. There is a lot of happening now. Yeah, exactly. The knowledge is there, the technology is there, and the communication is there.
Well, I think you look at the RB, like a couple of years ago, well, they've done the RB conference virtually like 2 years ago. And you look at the range, like there was people from all over the globe attending some of those meetings, right? Like Africa, Australia, England. So you had doctors from all over the world that were like coming together and hearing, different things that were going on. And I think, like you said, Jennifer, like that's what's amazing about the technology and the spread of knowledge. And I think, 40 years ago, it was probably way more isolated. And one doctor studying it, they didn't necessarily know what a doctor across the country was studying or looking at, or what they were even doing, right? So,
that's probably true.
To compare treatments or to compare cases.
Because I know the doctor that I have seen, like more locally where I live, like after treatments, as following up, he is a retina specialist. He is an ophthalmologist, but I know like he's seen, I mean, he can count probably on one hand the number of RB cases that he's seen. I know he said one of the last times I saw him before he passed away, he had said that he just referred somebody on whose child that he was, I think he was leaving it to the very extreme specialist beyond just, he's a general retina specialist, but he sees like glaucoma, he sees, cataracts, he sees RB. So more of maybe a kid's retina, like ophthalmologist type person, to diagnose. But he had said that he was, referring her on or whatever. And then the girl I talked about earlier, that's like 6 weeks older than me, he also sees her. Now when I went to treatment, like we went there at the time, there was like a specialist in Rochester, Minnesota at Mayo Clinic there, and we went there. And then my mom would know the guy's name, but there was a guy that was in New York that was always known for retinal specialists. So, I mean, I always, have seen them, but you guys are right. And I guess I didn't think about that as like, how easy it is to share information now. But I know like as an adult, as I've looked into like the risk of secondary cancers and, things like that. And just after going to that conference, I mean, the average GP doctor, at least around here, they may be the best doctor around, the most, well-versed, and even going to like the hospital locally that is kind of the cancer hospital, if you have cancer, this is where you go, at least if you're going to go around here. I feel, and I don't mean this to put down doctors, but I feel like I know more about RB than they do.
Because
And it's hard. I mean, it's sad to say, but
you do.
especially after going to the international conference. But I mean, and I even went to, there's a gal that's supposed to like, she's like an APRN, specifically takes patients to help them look at what do I need to watch for? What are the secondary cancers, helping you get resources of what you need. Do you need a dermatologist referral, whatever. I went to see her, and bless her heart, she did her research. She had a big packet of stuff and all this stuff about RB, but I still knew way more than she did. And I was like, I didn't say it to her, obviously. I didn't mean it against her, but I'm like, well, this is a waste of my time. I know more about what I need than she does right now. But, I'm hoping to be able to go to Hawaii, but it's almost $1,000 to fly there. So I don't know if that one's going to happen.
Yeah, I know. That one it's hard because I think for any of us to go, like as much as we would all love to go to a conference like that, I don't know. The travel is what's limiting.
We need a travel stipend.
I was able to, the Washington DC one. I mean, it was still across the country, but at least it was in my country. So that was a little bit more doable. And I was able to find somebody through, if you guys know who Marissa Gonzalez, I think Gonzalez, yeah. Through, she was able to help me like get connected a little bit with, some of these Facebook pages. And I found another girl that was going, and we were able to like share a room and stuff. So that, half the cost of, of a room and things like that, as far as hotel room. But which all helped, and it was greatly appreciated. But yeah, I was like, I looked at the just the flight, not hotel, not food, not conference fee, nothing. I was like, holy moly, that's a lot of money for a 2-day conference.
So I'm just mindful of time for us. I know that we started a little bit late because of our Zoom link issue. We were supposed to finish up at 9, and I realize it's a Thursday. People probably have work tomorrow, so I just want to be mindful of time. It's 9:30. I think what I've gathered from this is that truly us all coming together, there's two kind of themes I've noticed. One is I think there's way more to sort of to talk about, and to have an open floor to talk about what parents need, because we always talk about what the kids experience and the medical trauma that the kids experience, and parents experience so much medical trauma as well, and it lingers and it lasts forever. And I'm going to be 34 this year, and my mom would probably connect with the RB moms here about the anxieties continue existing even when your children are adults. So I think it's great that we can all come together and kind of share that and be able to talk about that a little bit more, and find another time that we can maybe set up a call for parents to talk about really just their experiences. And then the other thing I noticed too is just all of us being able to come together, and Lindsey talking about like, oh, your daughter had this, maybe I can kind of follow up with my doctor about this. So we all get ideas about what we can do to support each other and to maybe improve our own experiences and our own sort of medical stuff moving forward. So I always love these calls because we can always learn from each other and spark different things that we can jump into, which is really exciting. So I'd love to thank Lindsey for sharing your story and being able to guide a bunch of us in different ways to, maybe cope with some worries that we have and the what ifs and those kind of things, and give people ideas of what to think about moving forward for other, for Lindsey to maybe follow up with doctors and stuff. So I appreciate you being able to share all of your experiences with us. It's really helpful. And for everyone's questions and you know, always such a great time for us to all get together. If we had the resources to do this like every 2 weeks, it would be amazing because we all have so much to talk about. We could just be on the call forever.
I think Brian has his hand up, Natalia.
Oh yeah, go for it.
Oh, there's a question in the chat, Natalia,
Sure.
I don't know whether you can see it, from Vicky, who is
Yes.
welcome if you're able to speak it in, but I don't know whether your circumstances right now, you're able to either turn on your video, no pressure, or to speak it to us, or else I can read it out, Natalia, if you aren't looking at the chat.
Sure.
When you said sure, did you want me to read out Vicky's question?
Yeah, that works.
Okay. Oh, there's Vicky. Okay, Vicky, go ahead, unmute and fire away. Hi, Vicky.
Hi, everyone. Thank you for for the information today. So I just have some information and need your advice. Yeah.
Go for it.
Yeah, you can hear me clearly?
Yes.
Yes, thank you. I have my kid. He's were diagnosed in retinoblastoma when he was 2 years old. During the COVID-19. So in my country at that time, we have a social distance. So at that time, I cannot come to the hospital immediately. And then after 3 months, his eyes become worse. So the doctor did the surgery to remove his left eyes forever and use the chemotherapy for nearly 1 year. And now he's in 5 years old. His health currently, I checked with the doctor, is okay, but he's scared of a stranger, and he easy to lose his control. He easy angry, and when he stay with me and his daddy is okay, but when he come to the new environment, for example, he come to the preschool, the teacher love him and he love teacher, he love friends, but he very scary and he angry. So I come to the doctor. The doctor say that we need more time to assess whether he has autism or not, because that maybe the chemotherapies will affect to his mental health. So I'm really appreciate if your advice could for me, so that how can I have him to grow and balance his temper as a normal kid. Thank you so much.
Celine, do you have any advice just with your experience and also being in the education system?
I can try. I mean, Vicky, what country are you in right now? Are you from Canada? Like you're in Canada?
I'm come from Asia in Vietnam, and now currently I'm live in Canada.
Oh, okay. So you do live in from Toronto? You're from Toronto?
I'm currently live in Saskatoon in Saskatchewan.
Oh, Saskatchewan.
Oh, Saskatchewan. I see. Okay.
Yeah.
Well, it might be different there. The way the education, I mean, says the school boards work there, their curriculum's a little bit different too, but maybe talk to the principal and see if the special education teacher at school can do something called it's kind of like a school-based support team. They will meet together, and the teacher in the classroom, your son's teacher, the principal, and the special education teacher can take a look at some of the different examples of issues that they're having in class with your son. Maybe some examples of when his you're saying that he's sometimes getting upset or losing control, angry, biting. So maybe they can try to find out the times that that's happening, and take some of that example of when that happens in the classroom to the meeting. And then what they will do is kind of ask for a referral for somebody from the autism department at the board to come in, and then they would do something called an assessment, and then they would kind of look at his developmental just kind of the developmental stages, and take a look and see if whether or not he's where he's supposed to be at for his age, for like a typical 5-year-old. And then they would also call in a speech and language pathologist. So there would also be a psychologist that would come in and do a psychological assessment. So the school can kind of set that all up for you. And then they can refer you to, I know in Ontario, in Toronto specifically, there is Holland Bloorview, and they do a lot of different, they do different tests. So assessments are basically tests. So they'll try to figure out whether or not he is on something called the autism spectrum. So depending on where he is too, because like there are different degrees of how like intense it is too, if he is diagnosed with autism, whether or not he's on high on the spectrum or low or somewhere in the middle of that, that spectrum. There could be something that has to do with, I mean, going through chemotherapy, like you said, maybe that has affected his mental health. I think that's what you should do. The first step is to talk to the school teacher, the classroom teacher, the principal. Ask them if they can talk to the special education teacher and set up that meeting with the school-based support team, and maybe try to find out how they can properly get him diagnosed, because there could be a chance that he is not on the spectrum. Maybe he doesn't have autism. It's just kind of like him releasing some stress, right? Because this is stressful. This is a very stressful situation to go through. I mean, the pandemic alone, I feel like, was so stressful. Imagine on top of the pandemic, I mean, Lindsey and yourself now, Vicky, you're telling me that your child, was diagnosed with retinoblastoma. I can't even imagine, like, my son was diagnosed in 2017, and it was pre-pandemic. And if I take all of what happened then and put it in during a pandemic, I can only imagine what that did to not just to him, but to you too, right? And that kind of also is a ripple effect. So, how you and your husband were handling that emotionally too, they're like sponges, so they kind of absorb that too. And I feel that can take a toll on a child's mental health 100%. So I think before like jumping to conclusions and like labeling him as maybe having autism spectrum disorder, I think the best course of action is to just kind of talk to the school, talk to the teachers, and see if they can try to get all of that sorted out. Because there could be a chance that that's definitely not it. It could just be like, it could be oppositional defiant disorder too. It could be him, like, and what ODD is just him kind of being aggressive and upset and lashing out on, every little thing, throwing temper tantrums, right? It could be ADHD. We don't know. It could be nothing. It could just be stress. So definitely get that taken care of by like a professional and see what they have to say. And I hope and pray that everything works out for you and your son. I know it can be difficult to deal with all that, and then on top of that, having to deal with all that ordeal. So I can see your son. Is that your son? Yeah. Hi. Hi, honey.
Yes.
Hi. Yeah, I mean, take a look and see what the school can do to offer to help you. And it is a public school. I'm assuming it's a public school in Saskatchewan.
Currently, because at the December of this year, he will come to the public school. Currently, he study in the preschool. Yeah, and
Oh,
on preschool. And because sometimes I'm confused that sometimes he understand what his daddy and me together. Sometimes he grows up angry, and so sometimes our emotion also up and down. So I'm also worried for him. So I have talked to the teacher. The teacher very love him, take care of him, and try to make him happy. But he just scared whenever I go. Yeah. So thank you for your advice. I will take more time to follow with him and follow with the teacher, so
Yeah.
that I'm hope that this will be not for autism. Yeah, thank you for your advice.
He's still really young too. They don't They don't generally diagnose until after age 5, sometimes age 6. Under age 5, they don't really typically diagnose anyways for autism. There are so many different milestones they have to hit before they can even like pinpoint and figure out if that could be what it is. So it could be just something, it could be nothing. It could be something, it could be nothing, right? And yeah, it's always best to stay positive about it. You're doing a great job, you know, bringing that up and like coming here tonight, I think, to talk about it. I think that's a big step too. And you know, just being vulnerable and opening up with all of us here. So, you know, I appreciate that too.
Yeah, thank you so much. And could I have one more question that as a mom, so how can I overcome? And sometimes I feel that I'm hiding about the things, and sometimes I would like to raise awareness for some mom and dad so that they can know and protect for their child. But sometimes I'm scary when the people look at me. I don't want they have feel that I have a baby with cancer. So do what advice so that I can, because I would like to raise awareness, because before I have in the roof, many people try to raise awareness about retinoblastoma. If we know as soon as possible, it will be reduced for the bad condition for the kid. So what your advice so that we can be stronger and we can be feel that it's normal?
Sorry, Brian, is it possible if we can try to get Vicky's like privately later on her home address, and then I want to send her a copy of my storybook.
Yeah.
I'll send her a copy of my storybook for her son to have, and then maybe that can be like a way just to help like kind of understand it in a through a social story. But if Brian, if that's something that you can do, if you could set that up for us, like maybe you can send me her an address. And Vicky, if you have the email for the Canadian RB Society, do you have that email? Maybe you can send email later, not right now because it's being recorded.
Yes.
Send the email, to Brian with your address, and I will be happy to gift you a copy of a storybook that I wrote called The Extraordinary Eye. My son's eye was also enucleated and removed. So it's a children's storybook that talks about just the whole process, you know, of being diagnosed, this, you know, the walking through the hospital, the you know, having that the initial MRI, and then the doctor coming to tell you that it's cancer and retinoblastoma and removal of the eye, then going back home. So I really think that something like that with pictures will help him understand too, and something he can take to school and show his teachers, and really help him embrace confidence and take away that bad thing called, you know, stigma. Yeah, you shouldn't feel like that. And, you know, eventually that'll never go away, that feeling, that terrible feeling. But I think that just, you know, being a reminder of like just being positive and being you know, reminding him all the time that there's absolutely nothing wrong, having an extraordinary eye, you know, like we took away that boring sick eye and gave you this amazing eye, you know, and you're different, and that's awesome. And to embrace that and to have that, to empower him, to make him feel good. I think that in the end you'll also feel good about it too, because you'll see that reflect on him too. But I think we always have to just kind of push that on them and make them feel good about it. I think that's all that I can really say. I mean, what about you, Jennifer, Lindsay? You too, you know, I feel like Dave too, right? David, I mean, you guys are like,
Vicky,
you guys
if I
are
could
like
just
here
say-
proof, right? That whatever your parents did work, right? So
Vicky, you talked a little bit about like that guilt and just, so I think for me, what has helped is just talking about it and not being like feeling like I did something wrong, or, you know, or I'm very open about talking about it with anyone who asks, or talking about it with my daughter, talking about it with whoever. But also, I think what's helped for me is just as connecting in through groups like this, meeting other survivors, patients, parents. I don't know if you like, or, you know, there's a Facebook group for parents through sick kids. There's a Facebook group, and I think that's been good in terms of just like connecting them privately with some parents one-on-one, just through Messenger. Like I've just randomly messaged some people sometimes, or we might have like passed in the hospital and then we like kind of, hey, was that you today? And have connected, and I've made a few friendships. Just getting to know other parents and talking to parents, or like, you know, I know you're in a different province, but when we went to the picnic and getting to form some relationships, and I think just to building relationships and just kind of finding the retinoblastoma community and just connecting with other families who are going through the same thing as you, we, you know, can really relate off of each other. And there was another mom whose son was going through the chemoplaque trial about a week behind Olivia. And so we really connected through that, because we would be like, how did your appointment go? I'm here today, and those kinds of things, and talk about like our journey through it, because we were on a similar path. And so I think is just like trying to find those, you know, joining a couple of Facebook groups that are dedicated to RB, you know, coming here tonight to the Canadian Retinoblastoma Society and meeting some of us. And, you know, you're always welcome to message or use the society to get in contact with anyone here, to just like kind of find your support group.
Yeah, thank you. Thank you for your advice.
Sorry, Vicky, I put my email address in the chat, so when you have a moment before the recording and the call ends, just write that down, okay? And you send me an email with your information, okay? Okay.
Vicky, I totally agree with the others talking about, like, when she was talking about looking into the school system. I'm from the United States, so I don't know how it works up there. But that's my job here, is like, here they call it like an early childhood special ed teacher.
I think we lost Lindsay.
Yeah, I think so.
Yeah. How often do we meet like this? Because this is my first time I've ever been in a Zoom call with you guys. I'm usually with Crab. I do things with Crab, but I've never done anything with you guys. I'd love to.
Quite enjoying this tonight.
Yeah, me too. I mean, we went
Yeah.
past the time, but my kids are asleep. My husband took care of that. So it kind of gave me the excuse tonight, but it felt really good. I think this was really much needed. I'll never forget talking to David too at the symposium last year. He made me feel so good knowing that like he could like, I mean, not I'm like, we're probably the same age, but I'm just saying like that like you could be like a vision like for me like a vision of my son like just before my eyes, you know, like I'm seeing my son kind of, you know, like this is going to be him one day. He's going to be married with kids and he's going to be totally fine, you know. So I think it's like a reminder too for us, like every time we get together at that symposium every year, for me it's been sort of like therapy for me. Like I've like, especially the first evening when we're all kind of talking, like I feel like this is some very similar to that we're all kind of just talking about our experiences and just our issues, and you know, it's like it's in real time, and I think that's so important. And I've like known Lindsay for some time right now. During the pandemic, you found me, I think, right, Lindsay? Like you found me on Instagram.
Yeah.
And like you connected with me instantly, and I thought like, who is this awesome person? And you know, I think social media too has really evolved even since 2017, as like was never on Instagram before that, and now I feel like I'm finding a whole RB community that I never knew about. Like I don't know if you
Yeah.
guys saw my
There's some pretty
story.
amazing
Yeah.
RB families out there, and almost like like just I love following other RB families and just kind of what's up with them, right?
And so much cool stuff out there, like someone named BS Machinist, his name is Brian also. And he created an LED prosthetic eye, like with an LED light inside, and I had sent him a copy of my book last summer, and he just made an awesome video about it.
I saw that yesterday.
Yeah,
and
like I just
beautiful.
thought, like, how cool is that it's reaching so many different people around the world, especially in the US too. I really think that we're kind of like all kind of finding each other more now because of Instagram blowing up over even more so over the pandemic. So I think that this was much needed, I think too. This is a great idea. Thank you so much, you guys, for inviting me today. I didn't know about this. Jen actually brought it to my attention. I know she's not here tonight. She's got some other commitments tonight, but I'm really glad she messaged me about it. So thanks for inviting me. And Lindsey, thank you so much for sharing your story. I didn't know much about it until tonight, and I can appreciate all that, and trying to understand your journey too, because it's just like that life map that like Ivana had put together. Like we were working on that, the roadmap, and everyone's roadmap is going to be different. You know, it's not a one size fits all. Cancer is not a one size fits all for anyone. And retinoblastoma too is it has so many different treatment options and paths that a map is required, you know? Yeah, so thank you so much for
I'm
everything.
glad you guys were able to join. We try to do these probably every couple of months, and we usually have them sort of themed for a different topic. But just like you're saying, Talene, it sometimes just bringing us all together, and we don't really even need a topic. We could talk for hours, right?
Mhm.
So it's always something that we're trying to think about, of, you know, being able to do more, and just having some of these gatherings once every, you know, couple weeks, couple months, so that we can all come together. And then people like Vicky who live far away and maybe can't come to the symposium or to the picnic, we can still kind of loop everybody in and stay connected. So
I
we
love that
always think
you
about,
did the picnic last summer. Like I know you probably
yeah,
done them past, but like that was wonderful.
we're doing it again this year. So on our website, you'll see our upcoming events. We will have the picnic again in June. We're pulling together the details in the next couple of weeks. So stay tuned to that for sure. So yeah, just keep
I'll try to
keep an
come
eye.
this time. I
Yeah,
missed out last year.
Yeah, my kids loved it. Like we were a little bit late because we had another commitment, but they loved just getting to see.
yeah,
Getting
yeah,
to see
we'll
some other
absolutely
families.
we'll have the details coming up in the next little bit. And then, you know, our website's got the rest of our upcoming events, some virtual, some in person, so we can reach more people.
I will say your time, like I know for some of us it is bedtime, but for the kids, but it's also nice because like it's not, you know, it's easy to, the work day is done, you know, dinner's over with, and can kind of yeah.
That's good. So this time slot, like 8 p.m.-ish, is good for people for the
I
most
liked
part.
it.
Nice.
My alarm at work's gonna go, so I'm just gonna go shut it off.
Okay. Is there anything else anyone has on their mind before we log off for the evening?
Sorry, my phone died. I didn't mean to leave you all. I thought I'd come back and at least say that, and thank you for letting me join, and
Glad to have
the
you.
other Lindsey for sharing, and the others that have shared their stories. But I did put it in chat, and I just said if anybody else wants, you know, I don't know, a survivor's perspective, like, yeah, it's different 40 years ago, but you know, I've talked to other parents as far as like more from the personal experience of it than the parent one. I'm always curious to, you know, then I get to hear what other people are, you know, like the newer things that are happening. And if I can be of any help to other people, then definitely reach out. I'm on several of the Facebook groups for retinoblastoma.
Awesome. And keep